Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Pseudotumour cerebri, which is also called as benign intracranial hypertension. So, in pseudotumour cerebri or benign intracranial hypertension, here the blood pressure is increased, but the intracranial pressure is increased, but there is no known cause. Like there is the CT scan will be normal, there is increased CSF pressure will be seen, but there will be normal CSF composition. So, first risk factors of the uh, pseudotumour cerebri. So, in the risk factors of pseudotumour cerebri, the pseudotumour cerebri can occur in obesity, oral contraceptive pills. It is associated with hypervitaminosis A, tetracyclines, nalidixic acid, and steroids also.
thank you and thank you for watching.